Let's share the screen and well, can you see the first slide?
Yes, teacher.
Is it full screen?
Yes.
Okay, thank you for the feedback. So the unit 3 we're going to study today is about instructions and procedures that are done in hospitals just to do some investigation of the patient's conditions or some kind of treatments, and also how to instruct the junior professionals about these procedures. Before we start speaking about this, let us focus on the home assignment that you've done. And so you remember that it was watching video, and there was a form that you had to complete about the names of the people in the video, about the symptoms, complaints, age, and so on. Well, it was a kind of surprise for me. There was a mysterious phrase in some students' papers. You can see some screenshots here on this slide about the symptoms that the patient was speaking. Well, I can understand, for example, the soft throat, but it's not the symptom. But one of the students wrote about food, source food. Well, it's how can food be a symptom of a disease? Well, if you if you are not sure about the spelling of the word or a phrase, you should consult the dictionary. And this is actually very commonly used just medical term, sore throat. So you should do some efforts to spell it right. So, I mean, sometimes students are so careless, I don't know why, so they write ridiculous things. Well, but all the other just information was all right. So, and I see that you have watched the episode, and so do you have any questions about the homework? No questions. So all of you who have done this, so you got maximum score of 10 points for the homework. And well, if we start speaking about instructions and procedures, let us have a look at the pictures here on this slide. Well, here you can see 3 pictures, and the question is, what is happening in the pictures, and what do you think happens before and after? So I didn't mark who has come. Is Afs here? No. Yana? Yana?
Yes, teacher. Yes.
Yes. Okay. Yusuf?
Yes.
You are here. Well, the next is Bilal. No. Swat? Is Swat here? No, Swat is absent. Noor is in there. Okay, so Aisha?
Here, doctor.
Okay, Ramil is here. Abdul Rahman?
Here, miss.
I see. Well, and so if you analyze what is shown in the picture, Yana, what can you say about picture A?
So I can say that there is a doctor that is inviting the patient to lay down on the bed, on this bed. So I guess this patient before this pic injured his leg just a little bit because he can walk, obviously. So he's just letting him to lay down. And I guess after that, he will give him the medication or what else, and he will alleviate. It's just a simple thing. That's what I guess.
Yes. And we can see that the doctor is holding some kind of piece of clothes in his hand. Maybe he's inviting the patient to undress and put on this medical clothes.
Yeah.
Mhm. And to do some investigation to examine the patient, right? Okay, great, thank you. So if we have a look at picture B, what is this woman doing in picture B? Yosif, please.
Okay, the doctor, she's studying about the patient or writing information about the patient, something like this.
What do we call this form where a doctor writes down the information about the patient?
Report.
Report, okay, so yes, and you can see a pile of just other reports about patients. Yes, the doctor is very busy. Okay, and I guess she has examined the patient before she started writing or just talked to the patient. Good. And in picture C, what is happening there? Let us listen to Aisha.
Maybe they examine the patient, or they prepare for a specific examination for the patient.
If we look at the age of these people, so one of them is a little elder.
Maybe the student, yeah.
Yes, maybe he is just giving instructions to the younger junior doctors how to do some kind of medical manipulation. And what will happen next? What do you think?
They will ask the student question about the patient and like this thing.
Okay, and if the elder person, the just senior doctor, for example, or professor, has shown some kind of procedure to the junior doctors, then I think he will ask them to repeat the procedure, just to check how well they've learned this procedure. Well, and so one more set of pictures here, the same question, what is happening in the pictures and what happens before and after. Now, if we listen to Ramil, what can you say about picture D?
So in the picture D, doctors, they are telling something about patient, I think about his disease, about his treatment, I think. And I think one of the relatives of patient also here gives him the, you know, kind of supports him mentally.
Yes, because one of the doctors is smiling. Yes, they are very positive. Mhm. And where are they? What do we call this place?
Restroom maybe? Oh no.
Okay, this is a place in a hospital anyways, right?
Yes.
Mhm. It's called a ward. Ward. So
Ward.
Mhm. And yes, and they are doing some ward round in the morning when the doctors and specialists, they just come to patients to check the progress of the treatment and to prescribe some procedures or medications to patients. Well, and thank you. And picture E, Abdelrahman, what can you see here?
It seems that the doctor is speaking with the nurse about the patient's condition. The nurse is smiling, so they seem to be happy of the result.
Mhm, mhm. Yes, they're discussing some maybe professional issues. Mhm. Okay, or yes, so then the nurse will go to the patient just to do some kind of procedure. Good, and picture F, Yana, please. What is
Yeah,
happening?
so here there are two doctors. They
Mhm.
are seeing a file, maybe of a patient, maybe of a bunch of patients, and they are discussing, I guess, their their issues. And one of these doctors are not interested so much. He's like sleepy, kind of,
Mhm.
and the other patient is willing to like share the informations with him.
Mhm. And what can you say if one of the doctors looks tired? So does it mean this is the end of his shift? Yes.
Yes, yes, because also he puts the jacket on his hand, on his forearm. So I guess it's the end of his shift and he's returning back home.
Yes, and he gives information to the next doctor who has come. So this is the beginning of her shift, and she should know everything about what happened previously.
Yeah, so they are swiping the shifts,
Exactly.
obviously.
Mhm. Thank you. Okay, and so these are the some situations that can happen in a hospital, and this is on this slide we can see there is a definition of the word ward. This is a separate room in a hospital, typically one allocated to a particular type of patient. A ward. Can we talk about your own experience in a ward for the first time? Have you ever been in a ward? Maybe as a patient or as a relative of a patient who is in a hospital. Have you ever been in a ward? Who can share the experience? Ramil, do you have
Yes.
such an experience? Have you been in a hospital? And what did you feel?
Mm,
No. Mhm. Okay, so you are lucky, just you haven't ever been in a ward as a patient or a relative of some sick person. But I think you've watched a lot of serials, like a lot of programs about hospitals. So can you think of any? Do you watch any serials, any programs about
the
doctors?
teacher, actually, I haven't had so, let's say, serious diseases, and that's why usually I went to the main, even if hospital, I went to the doctor's room. He gave me the treatment, and then I went back to room. I never stayed in a ward, but I once was a ward as a relative. So it was my grandfather. Was my grandfather, and he had problems in his lungs and heart, like pneumonia, which I don't remember the disease. He couldn't breathe properly. His heart didn't work also properly. It was a serious disease. Because teacher, he smoked a lot. That's why.
Mhm. I mean, what was your impression about the people working in a hospital? So what is important for them? I mean, how should they just do their work? Were
So
you-
teacher, I was actually at that time was a little child, but I think, as I remember, for doctors, it's very important that healing or treatment of patient.
Mhm, mhm. So, anyways, you remember that the doctors visited your grandfather and talked to your relatives about your grandfather's condition. So just gave them information about him. So it's very important, and there are some specific rules for the doctors how to behave in a ward, and how to talk, how to communicate with the patients and his relatives. Okay,
Exactly.
and thank you for sharing. And so I mean that yes, there is another term here, ward round. So the ward round is a visit of a doctor to a hospital, to each of the patients in a ward, and it's normally done at the beginning of the day, early in the morning, just to prescribe the treatments, medications, and tests, some medical investigations. Well, and now, so if we see, if we look at the information on this slide, we can see several tips. These are the tips for the first word round. Yosif. And so the tips are given by an experienced doctor to junior doctors, how to behave, what to do, what to remember. Let us read these tips and answer the question, why do you think each tip is given? Why is it important to do like this? Is Afs here? Afs, have you joined us? No. Yana, please read tip, the first tip. Yana?
Yes, teacher.
Mhm.
You want me to read? Sorry, I didn't hear you.
Will you read line A, sentence A?
Okay. Sure. So make sure you know the names of your patients and where they are.
Why do you think it's important for a doctor on a ward round?
Because each patient has its own file. So each patient has its own information and own diagnostic. And also it's kind of showing some care to the patient if the doctor knows it, and kind of gives him or her the safety feelings. Or safe, I guess.
Yes, sure. Thank you. Great.
Thank you.
So the next is for Yosif. Is Yosif here? No.
Yes, doctor.
Yes, you are here. So line B.
Find out from the bed managers if any patients have been moved and to where.
So why is it important to know?
to monitor the patient's condition,
Mhm.
doctor.
Yes, I see. Okay, anything else?
And maybe because the patient it's in order and not worsen the station.
Mhm. Mhm. Okay, yes, good. Ramil just wanted to add something.
Yes, teacher. So in the hospital series, bed modes, for example, we have strict bed mode, the half bed mode, the ward mode, and etc. There is some type of patients where they are not allowed to move, like stand up and go from the bed, even move to sides in the bed. Some
Mhm.
patients can, go to the toilet freely or eat, stand for eating, etc. And for example, maybe it has a bone fracture, and in this type of fractures, you shouldn't make more like an immobilization to your side. So your fracture could be healed as soon as possible, more quickly.
Mhm. Okay, so anyways, when doctor comes on a ward round, he or she should know about the location of the patient they are treating. So, and if the patients have moved somewhere, they should know where to find the patient. So I don't think it's
Yes.
a common practice to move patients from one ward to another, but sometimes it happens. Mhm. Okay, good. And now the next line is for, so who is here? The next line is for Aisha, please.
Oh, yes, doctor. Check that all the case notes, investigations, and so on are on the word.
Mhm.
I think because so that there is no confusion between the patient's files and information and important notes, so as not to confuse two illness.
Exactly, yes. So the case notes gives all the necessary information to make conclusions, to make decisions about the treatment. Okay, great. Abdul Rahman, are you here?
Yes, miss.
So please, D is for you.
Invite a nurse who knows your patients to come on the ward rounds. It's a good tip as the patients will be more comfortable with the nurse as they already know her,
Mhm,
and be a lot less awkward for the patient
mhm.
when they need to do personal stuff or
Exactly.
private stuff.
Okay, good. And Ramil, please, the last line here.
Record case histories and results clearly and concisely. Another important tip, because case histories are necessarily or important to know about the patient's disease. It may also affect it. That's why
Mhm.
in nowadays.
And it can be read by other specialists, other doctors, so it should be written
Yes.
clearly. Good. Now let us just move. Yes.
Unit 3.
And so here we're going to listen and complete the reasons given for each tip. So the senior doctor just explaining why it's important why these tips are important. She's doing the same as we have just done. And now let us listen and use no more than 5 words for each gap. So it means the same tips that we have discussed, like here, the first one. Make sure you know the names of your patients and where they are, as you want to demonstrate that you are. And then we should write a phrase consisting of no more than 5 words. Now let us start listening, and please you make notes about this. Okay.
Unit 3, Listening 1. Unit 3, Listening 1.
Can you hear?
Yes, teacher.
Yes.
Okay, now.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
So, and I guess we need to listen for the second time now.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
So the first tip was about knowing the names of the patients. So what did you write in line A? Yana, please.
Can I answer? Yeah, no, right?
Mhm.
Okay, so make sure you know the names of your patient, and as you want them to demonstrate that you are familiar with them.
Exactly, you're familiar with the patients. Good. The following tip was about consulting the bed managers about. So find out from the bed managers if any patients have been moved and to where. Yes, Yosif, please.
Yes, make sure if the patient in the bed or not, or he moved or not. And last,
To avoid.
running around look to look at the patient if he where is.
Yes, to
like this.
avoid wasting time running around looking for patients. And she says, especially the consultants running around. Okay, the next was, so what was it? Checking all the case notes, investigations, x-rays, she says. so that you can do, Aisha, you can.
Miss D, because they may be more knowledge.
No, we are speaking about line C. About
Okay.
preparing case notes, investigations, X-rays.
Okay. Check that all the case notes, investigations, and sono are on the ward.
Mhm. So that you can. Who can help
So
us?
that you can
Uh-huh.
sure about the information of the patient.
What did she say? What exactly did she say about this? Who remembers?
I don't remember.
So, Yana, what have you written in line C?
In line C, maybe looking for patients to avoid wasting time running around.
No.
And
So that you can refer to them quickly. Refer to them.
yeah, all the cases
Cases.
notes in hand to
Mhm.
refer them quickly.
Okay. So D, invite a nurse who knows your patients. So let us listen to, yes, Ramin, please. Because
Invite nurse because they may be more knowledgeable about patients than you.
then patients, then you are, yes.
Yeah.
And the last tip is record case histories concisely. Abdelrahman.
Record his case histories more concisely, and that way you can clearly see the information that's represented.
Yes, she says access the information easily. Okay, well done. Great, thank you. And now it's time to pause for 10 minutes. See you after the break.